There's an outbreak of the respiratory illness MERS that has killed at least 13 people in South Korea as that country's president postpones his trip to Washington. Doctors say the MERS virus can spread as easily as, well, through coughing, for instance, but mainly through close contact, such as living with or caring for an infected person. Let's talk about it with Dr. David Samadi, chair of urology at Lenox Hill Hospital and professor of urology at the Hofstra North Shore LIJ School of Medicine. They call it MERS, Middle East Respiratory Syndrome. That's where it was first spotted. Now it's popping up in South Korea.
Well, this is as a result of a businessman from South Korea who traveled to Middle East, and they think that he got this virus from there. On the way back, he actually started having some fever, chills, very similar symptoms, John, exactly like flu symptoms. So it's very difficult to distinguish if it's a regular flu or if it's real MERS. Went to the hospital. It was missed 4 times. He basically went to 4 different hospitals in South Korea, and as a result, a lot of people got contaminated, and he's been spreading this virus all over South Korea. And so the big news over here is that if you have traveled to South Korea, if you start having some of those flu symptoms, when you come back, that's the trigger point. Tell them that you've been traveling, tell them you've been exposed, and for doctors to take all the precautions to put you in an isolation room to make sure that you don't contaminate other people. As you mentioned, contact way spread is the best way of travel for this kind of virus, so you want to be careful with this.
No indications, though, that this particular outbreak has reached the United States yet, but in this global economy,
that's right,
anything can happen.
Yeah, you said it right. You know, this whole world has become one small culture dish almost, because anybody from anywhere in the world can travel and bring this virus to us. So all the doctors in the emergency rooms are aware of this. We're prepared in case we see a patient like this. The key is to distinguish who has like a regular flu and who has MERS, and that's a very difficult part. There's no vaccine for this, and once you're diagnosed with this, it's basically just supportive care is the best way to go.
And if doctors haven't seen it very often, they probably think it is the flu or something very similar to that.
That's exactly right, but it still remains a deadly disease, even though it's not very common. There are people dying from this in South Korea. So recognizing it and treating it early before it gets to full-blown pneumonia is the way to go. But we're on alert, and that's what we're educating public.
And if you've been traveling and have symptoms, tell the doctors.
Immediately. That's the red flag. Thank you.
Dr. David Samadi, thank you.
Thank you, John.